Hi, everybody. My name is Mary Maida. I'm with Canine Cancer Alliance, a nonprofit that's working on finding a cure for cancer for our dogs. And we are interested in both research and prevention and cures. We are looking for treatments that are safe, effective, and could be accessible to many, many, many dogs, not just a few dogs, but many dogs. Now, today we're going to talk about metastasis, cancer metastasis, and what options there are today and might be in the future to help dogs with metastasis. Usually, when you hear the word metastasis, it's just analogous to despair. There's nothing you can do. And with conventional therapies like chemo and radiation, you might get a little bit of extra time, but cancer will return if it's already metastasized. But today we're going to talk about what you may be able to do and what researchers are learning. And before I start, we've had three very generous donors step up to offer donation matching, one-to-one donation matching. So if you would like to support our projects and give a donation, one-time donation, or become a monthly donor. We have these donors who are going to match donations up to $60,000. And the other good news is if you make a one-time donation that's greater than $50 or become monthly donor, then for monthly donors, the matching will be for a full year worth of donations. So if you donate $10 a month annually, that would be $120. So $120 will be matched by these donors. And also, if you become monthly donor or donate more than $50, we will send you our love calendar for 2025. So with that, we're going to start today's webinar. So this is a picture of our dog, Gus. Our Gus got osteosarcoma when he was 8 years old. And back then, I actually knew about the vaccine study at University of Pennsylvania. Just randomly, I had stumbled upon it and met the researcher. And so I thought, well, if Gus could get that vaccine, there's probably a 50-50 chance that he could actually be cured of osteosarcoma. But unfortunately, the study did not reopen and he never had a chance at the vaccine. So he had amputation, he had chemotherapy, and sadly, about 13 months after diagnosis, we lost him. And that's unfortunately the fate for most cancers. They actually come back the same location, like soft tissue sarcoma, or they metastasize to lungs or other locations. And that spreading of cancer is what ends up taking our beloved dogs away from us. So metastasized cancer means systemic spread, and today's conventional therapies are ineffective. So for example, I just want to show you an osteosarcoma Kaplan-Meier survival curve, which plots the percentage of patients still alive over time. And so this is a typical curve you see for osteosarcoma patients who are getting surgery and chemotherapy. So 50% of patients are alive at about 200 and something days. They don't even make it to 12 months. But the good news is immunotherapy can help. Immunotherapy works by activating the dog's natural immune system to target cancer. And so the listeria vaccine, which Gus unfortunately did not get, EGFR HER2 vaccine, which Canine Cancer is supporting. This is a study that was started at Yale University, led by Professor Mark Mamula, and the vaccine is available at 11 locations around USA, and early data is showing that it is helping dogs live longer than with conventional therapies alone. There are also other immunotherapy options such as immunocytin, which is a bacterial therapy that stimulates the immune system, and autologous vaccines, which are vaccines made from cancer, actually tumor sample, because cancer has all these unique proteins. So if you can give that as a vaccine to the patient, you could stimulate the immune system to look for them. And what's remarkable about immunotherapy is that the side effects tend to be much more mild than with conventional therapies. And if you get chemo or radiation, cancer killing is happening when chemo molecules are finding cancer cells. And it stops doing the work when you stop giving it chemotherapy. But with immunotherapy, if designed right, then adaptive immune system takes over. And so there's memory, and the immune system will continue to look for cancer cells and continue to kill cancer cells, even after the treatment is finished. And so it might just be 2 injections of vaccines, or it might be IV infusion, like sometimes immunocytin is used, but you can have long-term benefits. So immunotherapy can help slow and maybe reduce the chance of metastasis and recurrence. Now, how about cancer that's already metastasized to lungs or elsewhere? Can immunotherapy help? Now, here's a picture of Cody and Ranger. Cody was an early recipient of the EGFR HER2 vaccine. And some of you have probably heard directly from Mike when he joined our webinar earlier. But Cody had a very large metastasis in his lungs. He had already been treated with chemo, had amputation. Mike lives in New Jersey, and he came across the Yale vaccine, EGFR HER2 Yale vaccine, and decided to take a chance and traveled to Connecticut to get the vaccine. He was told by the clinician that, hey, we're really not sure what to expect. It's probably not going to help your dog. But after Cody received the 2 injections for the months, several months afterwards, Mike just said, oh, Cody's still here. Several months later, Mike took Cody back to Connecticut, and he had x-rays done, and his metastatic tumor in his lung had completely disappeared. Ranger's story is a little bit similar. Ranger also had amputation and chemo, and he also was on a clinical trial at Ohio State University. They live in Ohio, but his tumor kept on growing, metastasized to lung metastasis kept on growing. They came across the Yale vaccine, and they're very lucky enough to get the vaccine treatment early on, and his tumor completely disappeared from the lungs. So metastatic cancer disappeared. And both Cody and Ranger lived for over 3 years, and osteosarcoma did not come back. Unfortunately, they did end up getting a different type of cancer, hemangiosarcoma, and passed away. But they were able to enjoy roughly 3 years of very high quality time with their families. Now, it's not clear if EGFR HER2 consistently help dogs with metastasis, and it really depends. We don't know exactly why it helps some dogs and why it doesn't, but we do know that the vaccine does help slow and reduce the chance of metastasis. Now, there are now also studies that showed that metastatic osteosarcoma patients can be treated by repurposed oral drugs. And the reason that these oral drugs are used is because when cancer grows, it protects itself in a very special microenvironment. It will actually make a protective layer so that the cancer-killing immune cells can't penetrate it, and it'll fill the environment with protective immune cells, so immune cells that actually suppress immune activity. So here's Molly. Molly became a patient at Colorado State University, and Colorado State University had a couple of oral drugs that were candidates at modifying the tumor microenvironment. A couple of them are blood pressure medication that's widely available, and they knew that losartan could actually have the beneficial effect and act against cancer, but they realized that they had to increase the dose of losartan. And Molly was the first dog with metastatic osteosarcoma who responded well to losartan, and her metastatic lung cancer, metastasis began to shrink. But also, when they started combining losartan with another blood pressure medication called propranolol and Palladia, which is also called tozoramib, they could get better response with dogs with metastatic tumors. So Scout here had amputation. He went through chemo, but unfortunately his cancer came back in the lungs. But when she got Palladia, losartan, propranolol combination, the metastatic tumor in the lungs completely disappeared. And this 9-year-old dog was able to enjoy another 2 years or more with the family. And here's a picture example before this oral drug treatment was started, and then week 8 when the lung metastasis has disappeared. This paper by Stephen Dow and Dan Reagan, who are professors at Colorado State University, describes some of the data from this trial. So it's actually the combination of these drugs are stopping these immunosuppressive immune cells from being drawn in to around the cancer. And you can see in this Kaplan-Meier survival curve that after the treatment is started, so these are dogs with metastatic cancer. If you just give them tozoramib or Palladia alone, the progression-free survival is only about 57 days. But if you give them losartan, high-dose losartan and tozoramib, the progression-free survival is 111 days. And so that's the blue line here, where you can see that there's more dogs are surviving longer. But it's, hardly perfect. You don't see a long tail that shows that most of the dogs are cured. So this is definitely a step in the right direction. And it's a very helpful therapy, especially since this is oral drugs that you could just take at home. It's nothing like chemo or anything with strong side effects. I also want to bring up that radiation therapy can have immune modulatory effect. Now, radiation can be stereotactic radiation. So you give very high dose, concentrated dose, focused in just 2 or 3 treatments. Or it could be more gentle treatment, palliative radiation, where you might get a couple of treatments just to alleviate the pain, or something in between. Now, the interesting thing about radiation therapy is that it could have anti-cancer immune effect. Its main job is to try to kill cancer, harm cancer cells, and disrupt the DNA. But it actually can act and induce in situ vaccination. So it's almost like vaccinating the dog with that protein, because it releases these tumor proteins so that the immune system says, oh, this is what tumor looks like, and gets activated. But radiation therapy can also have pro-cancer immune effect, drawing in bad immune cells like regulatory T cells and myeloid-derived suppressor cells and neutrophils that suppresses immune system. So really, depending on the dose and the timing, radiation therapy could be very helpful, but it could be harmful. It could just only have temporary effect on metastatic tumor. And most of the study is being led by Colorado State University and Wisconsin, and also Washington State University is involved in a therapy with radiation. If you came to our last webinar, was it last webinar? I think maybe several webinars ago. Mavis's mom joined us. Mavis was diagnosed with osteosarcoma, and she came to one of our fundraising events, a 5K here in Redmond, Washington. And Mavis's mom learned about the clinical trial that Professor Mamula is leading. And at Washington State University, they are enrolling dogs who are not candidates of surgery. They're too big, other problems, they can get surgery, but they are treating them with palliative radiation and the EGFR HER2 vaccine and zoledronate. And so there's no surgery. This treatment has just minimal side effect. And Professor Mamula reported last month or 2 months ago at the Veterinary Cancer Society meeting that median survival is almost a year with the help of this palliative radiation and the vaccine. And this is probably because of the immune modulating effect of palliative radiation. They really need to do more studies. And this is still based on very few number of dogs, about 10 dogs. But Mavis survived for about 18 months without having to get amputation, but with the help of this combination of immunotherapy and radiation. So radiation can actually have beneficial effect, especially when it's combined with other immunotherapies. So we have talked to different families whose dogs have lung metastasis, and they are being treated with radiation therapy, stereotactic or other types of radiation therapy, and these oral tumor microenvironment changing drugs like losartan, palladia, and propranolol. So that may be a strategy. Now, but why does cancer escape immune surveillance? Why can't the immune system just keep cancer stable or kill the cancer cells altogether? And we had a webinar a few months ago on immune checkpoint inhibitors, but there are something called checkpoint molecules, and they are used to they are basically off switches for powerful immune cells like T cells. And they're there because you don't want immune system to just go into this runaway situation and start attacking your healthy tissues. So you have to have an off switch. But cancer can take advantage of these off switches, these checkpoint molecules, and turn off the immune system. But the good news is there has been discovery of these checkpoints. And now with monoclonal antibody drugs called checkpoint inhibitors, PD-1 checkpoint inhibitors, CTLA-4 checkpoint inhibitors, it's possible to stop cancer from suppressing the immune system. So you probably heard a few years ago that former President Carter had metastatic melanoma that had already spread to liver, everywhere in his body, practically in his brain. But with the help of PD-1 checkpoint inhibitor treatment, his melanoma completely disappeared and he was cured. And this is not true for every metastatic melanoma patients. It's only a fraction, maybe 20% or maybe 40%, depending on what combination you use. But not every patient responds. But a fraction of the patients will consistently respond to checkpoint inhibitors and can become cured, even with metastatic melanoma, which is great news. So, how about immune checkpoint inhibitors for canine patients? So, there is a drug called gilvetmab that was introduced last year by Merck. It's a canonized PD-1 immune checkpoint inhibitor, and it has conditional approval, and oncologists can order it from Merck now. Now, it has been tested with mast cell tumors and melanoma patients, stage 2 and 3 melanoma patients. And they've published some data on its efficacy. And when you look at these numbers here, in this table, it says 20% of melanoma patients, these are stage 2, 3 melanoma patients, responded with either a complete response or partial response. The bottom table actually is better. Complete response is 2 out of 25 dogs, 8%. Partial response is 12%. Stable disease is 40%. And so it seems that it is definitely doing something, but we wish there was more data. And the question is, can gilvetmab or other immune checkpoint inhibitor be used to treat metastatic cancer? And the answer probably is, we don't really know for sure, but the answer probably is yes, it may be effective if it's combined with something else, something like vaccine or radiation therapy. But by itself, there might be a few lucky dogs with metastasis that might respond to gilvetmab and the cancer might go away completely, but probably most of these dogs will need something else combined with gilvetmab, this immune checkpoint inhibitor, so that the metastatic cancer can respond. So here is Chata. This beautiful dog had mammary tumor and it had spread, metastasized to lungs. And in this study, which was published earlier this year, the researcher combined a checkpoint inhibitor. It wasn't gilvetmab, it was a different kind. It came from their university. They combined PD-1 checkpoint inhibitor with another strong immune stimulating drug, which was composed of plant virus, which is harmless to dogs and people, but still stimulates the immune system. And when Chata was treated with this combination of immune checkpoint inhibitor and immune stimulator, the lung metastasis stabilized or shrank. One lesion did get slightly bigger, but this is 315 days later. So she was treated and she lived for many, many, many months. And she had excellent quality of life, over 300 days, according to the research team. So there's hope, and we believe that it is possible to do these combinations to successfully treat metastatic cancer. So looking ahead, how do we treat metastatic cancer and maintain excellent quality of life? It's probably the combination approach that's needed to tackle metastatic cancer, vaccine, or other immune stimulating agent, maybe with in situ vaccination that could be radiation, palliative radiation, maybe cryotherapy. There are studies saying that cryotherapy done right will stimulate the immune system in a good way. Electrochemo may also help. Immune checkpoint inhibitors, there are different checkpoint molecules, so but immune checkpoint has to be addressed. So you need immune checkpoint inhibitors, and you need to also make sure that the tumor microenvironment is addressed so that you disrupt the tumor microenvironment and make sure that immune suppressing cells are not there. So I just want to share a couple of pictures of human patients. This is Renee Che. She is a PhD biologist who lived in Bay Area. And in her 20s, she was diagnosed with a cancer on her jaw. It was metastatic sarcoma. And her oncologist said there isn't really that much data for her type of sarcoma, but it's not curable. And she was given prognosis of only a few years. But she and her husband, because of their scientific background, began to talk to researchers, especially different immunologists, and sought out immunotherapy treatments that were not yet widely available in the US. They traveled to Mexico, got the old Coley's toxin injections. They changed their diet, increased omega-3, reduced omega-6. They had cryotherapy. She also had surgery also. And last time I checked, she was still alive, which is more than 10 years after her diagnosis. So even if one has a metastatic tumor, it is probably possible. It's going to be possible with the help of immunotherapy to get a cure. Here's another patient. She's a pediatric osteosarcoma patient. After University of Pennsylvania ran a study with canine patients, canine osteosarcoma patients, there was a pediatric clinical trial that was started with a listeria vaccine. And Kirsty Gomes is one of the patients who received the vaccine, and she had metastatic osteosarcoma. And she is still alive today, now 4 or 5 years later. So I think there's a lot of hope. Researchers don't know how to best combine the immunotherapy, how to best modulate the immune system to effectively fight metastatic tumor. But I think over the next couple of years, I think there will be ways to be able to treat metastatic cancer. Of course, it's better to find cancer early, treat it early, but even with metastasis, it is probably going to be possible. And there are some human clinical studies now starting to show that even with metastatic prostate cancer, mammary tumor, it's possible to reverse and stabilize with the help of combination immunotherapy treatment. So I think that's all I have for today. Thank you so much for joining the webinar. And if you would like to support the projects that we're funding, especially the EGFR HER2 vaccine trial and other trials that are trying to make immunotherapy work better, please go to our website and support us. And hopefully we'll be able to share with you our calendar, etc. Okay. Thank you very much, everybody.